Hello everyone, this is your host Rohan Tandel from InnovatioCuris Magazine Studio. I welcome you to this podcast produced by InnovatioCuris with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the first chapter from the 8th edition of the virtual IC InnovatorCLUB meeting hosted on the topic Transformation of Indian Healthcare System Post-COVID, brought to you by InnoHealth Magazine, the first magazine in India on healthcare and innovation. The topic of this podcast is Pain of a Hospital and Possible Solutions, composed and narrated by Dr. Amit Raj.
Good morning. I'm Dr. Amit Raj, CEO of Plexus Cardia Care. This company has a mission of starting multiple heart hospitals across Tier 2 and Tier 3 cities of Saurashtra, Gujarat state. Well, coming to the topic of pain of a hospital and possible solutions to it. So COVID has really taught us, a very lesson on this pandemic. So basic points would be probably, from my end, what we faced at our hospital on the COVID phase and heading towards post-COVID, approach is preparedness for something like a huge pandemic within this healthcare ecosystem. So preparedness more or less starts for us. Probably we felt, there was in a Tier 2 city where we feel resource planning, both in terms of manpower and in terms of material resource management and planning. Second most important point was clinical excellence team to kind of approach something like this COVID, and as well as the complications of post-COVID, post-COVID complications, how the clinical excellence team would have an approach and probably solutions to it. Always keeping in mind the quality of the healthcare delivery needs to be spot on. And support services, most important, which we felt the common areas of the hospital fields, a lot of pain is probably on the diagnostics. There was a supply chain disruption and infrastructure changes to kind of cater to this pandemic. So, and as well as most important is something like infectious disease management in a Tier 2, Tier 3 city. Usually infectious disease departments are usually there in a bigger metro hospitals, but in a Tier 2, Tier 3 cities where this kind of a super specialty department is kind of lacking, and we doctors would definitely want infectious disease department is set within a Tier 2 city, and then how approach and management towards a problem like this should be around. And now we, post-COVID, we've been seeing a lot of complications of, COVID, and there is a bizarre change in cardiovascular, cardiorespiratory, diabetic, mental health, all these clinical conditions patients have been presented with. So, and hospitals are tuning in to kind of have a different approach to these pain points. So how we address these are the broad line pain points which hospitals like us we felt, and most common is among them we felt is how a communication gap is set in from a Tier 2 to a Tier 3, then to a Tier 3 village. I mean, patients are finding it difficult to even get consultation with even an MD internal medicine, critical care specialist, super specialty specialist. So it's becoming a challenge. And manpower, again, in the beginning, I had mentioned that manpower resource planning is important. So we felt that there's lack of manpower, skill development among the manpower, and scarcity of medical and paramedical staff. So we all should focus on how do we improve this manpower resource planning. So probable solutions which we felt, I felt as a healthcare management consultant and as a CEO for my company and as well as a cardiologist, we felt that patients had developed a trust between the hospital and the doctor and the patient per se. Uh, and way forward, I feel that we should enhance this trust more with stronger bonding of trust and faith from a patient to a hospital and a doctor. This is most important. Well, understanding the needs of a patient at this hour, because two episodes of pandemic had really shaken the mental health of every individual and probably the patients who've been uh, having these symptoms and problems. So needs of a patient usually is on effective communication, quality healthcare, and financial stability, which where a patient can go to a hospital and afford the kind of treatment which a patient wants. So healthcare now should look at this basic needs of how affordable we can make our healthcare and keeping in and ensuring that there's a quality enhancement at all levels of healthcare delivery. And to to promote this kind of patient centric patient the trust between the patient and the hospital is number one, the effective communication and availability of doctors at all levels of the, the clinical as soon as the patient enters a hospital. So patients at a tier 2 city like Rajkot, Gujarat, and tier 3 cities where we feel now we should. There's a high time where insurance to be more penetrating the tier 2 and tier 3 cities, with the government scheme of Aishman being very effective. So we feel even private insurance players should take part in that to kind of cover all gamuts of disease and post-COVID complications. So, a healthy approach would be to promote a hospital also should inform and communicate and educate patients to have health insurance at all levels, and they should be, kind of promoted at a very early stage of individual, and then probably cover for the entire family, and also promote on quality care. Uh, Being a doctor, I feel quality care is something which at this moment is kind of to be looked into tier 2 and tier 3 cities, how we improve the overall patient experience, the overall patient satisfaction, patient centricity, and make it much more transparent and communicable to a patient. Uh, Most important approach would be for my company. We have taken the digital approach as one of the most effective way of kind of improving our and reaching our patient database. Reaching out to the last mile is our kind of mission, where we have approached we have taken digital route and wanted to create a digital ecosystem in early diagnosis and consultation. So as you all know, I mean, for the last 12 months, 12 to 14 months, people have been talking on telemedicine. We should improve the usage of medtech integration. A lot of healthcare devices are to be, used so that there's an early detection and easy consultation of a patient in their early phase of their symptoms and signs needs to be, looked into. And since a digital ecosystem is has to be taken overall, improving the most important at this hour is improving the rural health of the country using a digital approach is probably one of the decent solutions for us to kind of move ahead. And the next important area where I would also focus on a kind of a disruptive collaboration with multiple stakeholders of the healthcare delivery system. Name it vendor management, name it a good clinical team, kind of have a unique kind of collaboration. Have insurance players getting into this health ecosystem, have collaboration with government and their policies, so that a disruptive healthcare delivery can be rendered, and effective approach should be focused at. So also every hospital is planning, and we are as well planning towards a journey of healthcare excellence, both in terms of clinical training programs for the paramedical, medical, and the support team, and a resource planning uh, uh, for vendor management, and for the clinical team resources, because I mean, if a pandemic again comes in, so we should be geared up with our resources, both in terms of manpower and clinical. Effective education is and training, skill development for our medical and paramedical and support team is to be focused on. And the most important is effective communication with all stakeholders, name it patients, name it this clinical staff, the governing bodies, the vendors. So a kind of a disruptive and effective communication is the need of the hour. So I would focus more on at this moment a digital approach, so that keeping patients, bringing the doctor to a patient's laptop, devices, their smartphones is catching up. So we need to effectively have policies towards that, and ensure that there's an effective, the gap which was there can be easily merged with this effective tools of digital approach. And early diagnosis and consultation using medtech devices is also catching up. Most of the hospitals and small startups are gearing up towards this, so that there's an effective communication, there's a bridge, there's reach out, and there's an early diagnosis, and effective communication and consultation can be made. Most importantly, we feel now, secondly, the insurance part, the financial, every patient in a smaller town has run out of cash of their savings to kind of look after their health of their loved ones. So promotion of insurance is something the need of the hour, and the government has come out with their beautiful policies of Ayushman Bharat, which has to be kind of promoted and effectively managed at a smaller town and at village level. Thank you.
Thank you, Dr. Amit, for sharing your views with us. The link to listen to the full virtual meeting would be down in the description. To conclude, I would like to call out to our audience to leave a comment and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHealth Magazine Studio. Thank you.